So we are a complementary, supplementary, and primary nonprofit support organization. Everything here is free of charge, regardless of a client's ability or inability to pay. I just fitted a woman for a prosthesis. She had a unilateral mastectomy in 1996 and did tamoxifen for 4 years, went off tamoxifen in order to have a child with her new husband. She had a daughter. Her daughter is now 9. She has fortunately not had a recurrence in her remaining breast. She has not suffered metastatic disease, which is unfortunately relatively common. With the women that we work with, we see a lot of recurrences, a lot of complications from the treatments. Treatments are more severe when early detection is not in play or when a more aggressive cancer is the diagnosis. Our voucher program that serves women under the age of 35 to receive diagnostic imaging, meaning they have symptoms and need to find out what is going on in their breasts. If it's a cancer, it is almost entirely aggressive cancers in that age group. This is our patient support kit area. We put together these kits filled with national and local resources and information. It's a snapshot of what someone has to take in and start to become experts in upon diagnosis. So these items, including comfort pillows, handmade by volunteers. These are for post-mastectomy comfort. These are for underneath a seatbelt strap in a car to protect the chest. These go out free of charge to 75 surgeons' offices in 5 counties, primarily Pierce County, but 5 counties around the South Puget Sound area. This is how women find out about our services. This is how women find out about support groups. This is how they get connected. These are our donations that come in. We have wigs, breast prostheses, bras, camisoles, hats, scarves, heads, wig stands. We rely heavily upon donations of items. We use interns, volunteer help. We have 2 full-time and 2 very part-time staff. We serve hundreds of women every year, multiple times. Sometimes once we see them. Sometimes they are able to come back based on where they live geographically, what they can handle in their new life, filled with a million doctor's appointments and treatments. This is even our little bathroom where we have hand-beaded earrings with the classic breast cancer pink ribbon on them. These are actually sent to us from a man who is incarcerated, whose life has been filled with women being diagnosed with breast cancer in his family. And in his time, in his life sentence that he's serving, he spends the time beating these and sending them to us. And we are able to raise a few dollars per pair to help serve our clients, again, free of charge. In this room, we hold classes, we hold support groups, we hold rallies, really. every collection of women in this room becomes a support group. Our classes, our exercise classes, our relaxation classes are taught by certified professionals in their field who all have experience working with health challenges, specifically cancer, breast cancer. These classes have helped women, in addition to, sometimes as their primary physical therapy, to break down scar tissue, to gain range of motion after mastectomy. They're also specialized in reducing side effects from treatment. So teaching people how to increase their energy, what they can do at home in the morning to get going following a treatment, how to reduce nausea. It's support services, but they are essential. Some of these quilts that I'm showing you have been made by clients. This happens to be one made by an artist as part of Gig Harbor Quilt Festival. It was a fundraiser for breast cancer. This is Fishing for a Cure. I don't know if you noticed. I didn't notice. Initially, these look like canoes. Their arms crossed against a chest with no breasts, 2 breasts, 1 breast. Their belly buttons, their different shapes, more arms crossed all through the background. Our demographic is everyone. Our voucher program, while helping serve women under the age of 35 who are not served through state and federal programs for diagnostic imaging, can also help men of any age that are low income, or underinsured, who are in need of diagnostic imaging as well. And we have been closed since Wednesday, April 11th, 2012. And we need our doors to reopen. We need your support so that we may continue to support, at no cost, no matter a client's ability to pay. A nominal charge is going to cut out a great number of our clients, of our population, of our future clients who, as of this moment, are walking around completely unaware of a pending diagnosis. And we need this door, our door, to open to anyone, to open to everyone, regardless of their ability to pay, really regardless of their diagnosis. We fit wigs on someone with breast cancer. Yes, it's gone through chemo, going through chemo, losing their hair, but that is not exclusive to breast cancer patients. Those are available to any cancer patient, anyone going through chemo, anyone losing their hair. The right to walk through the streets and not be marked as a cancer patient and have to suffer everyone else's issues with that, with your more obvious side effects. We feel like that's not a vanity situation, that is just a right that everyone has. And we want to come back, and we want to help people fight to win every day of their treatment. Winning does not just mean getting to the end and being cancer-free for 5 years. That is not the definition of winning. It's making it up and being part of your life and having the strength to live through your diagnosis and everything that it brings, in addition to everything good in your life, everything that is rightfully yours to enjoy, to be a part of. That's what fighting to win means. And someone just tried our door and it's locked, and I could cry.